Hi, my name is Erica Armstrong and I'm a student physical therapist assistant from Jeff State. Today I'm going to be doing a treatment plan for a 4-day post-op right total knee arthroplasty to a 59-year-old female. The patient is a retired school teacher with a history of osteoarthritis in the right knee greater than the left knee. She lives at home with her husband in a 2-story home and states that her main activity is gardening. Her current weight-bearing status as of this time is weight-bearing as tolerated on the right knee. Subjective findings show that the patient complains of pain with weight-bearing less than 5 minutes and also when sitting with knee inflection. Objective findings show that the right knee active range of motion is 15 to 70 degrees of flexion, limited by pain. The passive range of motion of the right knee is 10 to 75 degrees of flexion, limited by pain and a capsular infill. The patient presents with decreased patellar mobility in the right knee in all directions, poor VMO contraction of the right quad isometric, and the right knee is warm and swollen to palpation. The patient's goals with therapy are to return to gardening and to ascend and descend her stairs at home independently. Today's treatment will include a joint mobilization of the patella, patient education on rest, ice, compression, and elevation, and a home exercise program for her to do at home. Patellar mobilization, superior and inferior glides grades 1 and 2 are chosen to increase passive range of motion and to prevent patellar adhesions. Okay, so what I'm going to be doing is a patellar mobilization. We're going to go superior and inferior to help with increasing active range of motion along with passive range of motion and prevent patellar femoral adhesions. So. Just going to go up and down. And this is just going to increase the patient's right knee active range of motion, which is limited by a capsular infill. We'll also do some medial lateral just to help with increasing that patellar mobilization because they're limited in all directions. But one thing we have to be careful is there's an incision right there with staples. The Rice method should be used with this patient to decrease pain and edema because the patient presents with a warm and swollen right knee. They should ice for 10 to 15 minutes twice a day and compress and elevate throughout the day to decrease the edema. Patient education. The patient is suffering from pain and edema. So what we're going to be doing is I'm going to be teaching them about the Rice method. So first off, what you want to do is you want to rest. You want to make sure you rest. And you want to make sure you ice it. You want to make sure you ice it 10 minutes a day, twice a day. You'll feel cold, burning, aching, and numb. That's exactly what you'll feel. When it gets to that numb, you can take it off. You also want to make sure you compress it, and I'm going to show you how to do that. So, and then the E is also for elevation. So we're going to go ahead and elevate while I'm wrapping. So, I'm going to get you to pick your leg up. And you want to make sure you elevate it above your heart. But you don't want to don't put anything underneath your knee, okay? You don't want to bend your knee, you want to keep it straight. So you want to make sure you start tight at the bottom of the knee. You want to make sure there's no wrinkles in it at all, because that will cause breakdown. And if your leg starts to hurt or starts to become numb or tingly, or your toes start to become blue, take it off because it's too tight. You want to make sure you wear it a couple hours a day, no more than 8 hours a day, but no more, I'd say no more than 2 right now, just because it's going to help with the swelling. Does that feel okay?
Yes, ma'am.
Like I said, you don't want to make it too tight. You want to do it tight at the bottom and looser at the top. All right, and like I said, you want to make sure you elevate it above your heart. So when you're laying down or you're in a chair, keep your leg elevated. Okay?
Yes, ma'am.
Try to elevate it twice a day. All right, any questions?
No, ma'am.
All right. For a home exercise, I chose hill slides to increase right knee flexion. They should do 2 sets of 10 reps twice a day with a 5-second hold, where there is no pain but a stretch. If pain or discomfort is felt, then they must let the PT know so that they can reassess the treatment plan. The home exercise program that I chose was hill slides. What it's going to do is it's going to increase his active range of motion since it is limited due to pain in the capsular infield. So what you're going to do is you're going to keep your legs straight and you're going to have a towel under your foot, and you want to slowly bend it and bring it up as far as you can until you feel a good stretch. You want to hold that there for 5 to 10 seconds, and you only go till you feel a stretch. Don't go till you feel any pain, and then you slowly let it back down. If you feel any discomfort or like any extreme pain, stop the exercise and let me or the PT know. That way we can address what's going on with your knee. But you just want to make sure you come up good and slow. You want to do 2 sets of 10 reps twice a day to help increase your motion. Okay? So do you have any questions? Okay, let's try that. Okay, so slowly bring your knee up until you feel a good stretch. Good, and hold it. Hold there for 5 to 10 seconds, and then slowly let it back down. And it's better when you do it with a towel underneath, that way you can slowly let it down and it doesn't like skid. Any questions? All right, well, thank you for letting me work with you. The patient's medical prognosis is good. With medical history unremarkable and no complications from surgery, the patient will recover completely with no requirements of modifications or assistive devices. She will be able to return to her previous level of function in up to 12 weeks. In PT, they will progress to the next phase of rehab in 7 weeks, which is the moderate protection phase, where they will begin active weight-bearing activities and strengthening activities along with single leg stance and squats. Thank you so much for watching this presentation. If you have any questions, just let me know. Have a blessed day.